What if everything you thought you knew about diabetes was wrong? Imagine struggling with high blood sugar, doing everything right, eating well, exercising, but nothing seems to work. Doctors tell you it's type 2 diabetes, but what if it's something else? A hidden form of diabetes that mimics type 2 but behaves completely differently. It's called type 1.5 diabetes, and thousands of people have it without knowing. Could you be one of them? In this video, we'll reveal the signs, why it's misdiagnosed, and what you must do to take control of your health. Welcome to Levitas. What is type 1.5 diabetes? Type 1.5 diabetes, also known as latent autoimmune diabetes in adults, or LADA, is an under-recognized form of diabetes that shares characteristics of both type 1 and type 2. Unlike type 2 diabetes, which is primarily caused by insulin resistance, type 1.5 is an autoimmune condition where the body's own immune system attacks insulin-producing beta cells in the pancreas. This destruction happens gradually, making it appear similar to type 2 diabetes in its early stages. People with type 1.5 often have a slower progression of beta cell loss compared to those with type 1 diabetes, where the destruction happens rapidly. Because of this, individuals with LADA may initially manage their blood sugar with lifestyle changes or oral medications, just like those with type 2 diabetes. However, as the autoimmune attack progresses, the body loses its ability to produce insulin, making insulin therapy necessary over time. Type 2 is primarily driven by insulin resistance, while type 1.5 is caused by an autoimmune response. Understanding this is crucial, as misdiagnosis can lead to ineffective treatment and worsening health over time. Why is type 1.5 often misdiagnosed as type 2 diabetes? Type 1.5 diabetes is frequently misdiagnosed as type 2 because it typically develops in adulthood, usually after age 30. Since type 1 diabetes is traditionally seen as a childhood disease, many doctors assume that an adult with high blood sugar must have type 2. Additionally, early in the disease, people with type 1.5 may still produce some insulin, making their symptoms less severe and easier to mistake for type 2 diabetes. This misdiagnosis is dangerous because the treatment strategies for type 2, like oral medications, are ineffective in the long run for people with type 1.5, leading to worsening blood sugar control. What are the early signs of type 1.5 diabetes? The early symptoms of type 1.5 diabetes often resemble those of type 2, which is why so many people go undiagnosed or misdiagnosed. One of the first warning signs is unexplained weight loss. Unlike type 2 diabetes, where excess weight is common, people with LADA may find themselves losing weight despite eating normally or even increasing their food intake. Another major red flag is persistent thirst and frequent urination. As blood sugar levels rise, the body tries to flush out excess glucose through urine, leading to dehydration. People may also experience extreme fatigue, brain fog, and difficulty concentrating, as their cells aren't getting the energy they need from glucose. Despite these warning signs, many individuals with type 1.5 appear otherwise healthy. They may not have the typical risk factors for type 2 diabetes, such as obesity or a sedentary lifestyle, making it even harder to identify. If you've been diagnosed with type 2 diabetes but are struggling to control your blood sugar despite diet, exercise, and oral medications, you may actually have type 1.5. Recognizing these early symptoms is critical for getting the right treatment before it's too late. How can you confirm a type 1.5 diagnosis? Confirming a diagnosis of type 1.5 diabetes requires specific tests beyond standard blood sugar measurements. The most important test is the presence of autoantibodies, such as GAD or glutamic acid decarboxylase antibodies, which indicate an autoimmune attack on the pancreas. A C-peptide test can also help. This measures how much insulin your body is producing. In type 1.5, insulin production starts out normal but gradually declines over time. If you've been diagnosed with type 2 diabetes but have difficulty managing blood sugar with oral meds, ask your doctor about these tests. An accurate diagnosis can make all the difference in choosing the right treatment. Why is insulin often necessary for type 1.5? Unlike type 2 diabetes, where insulin resistance is the main problem, type 1.5 diabetes is an autoimmune disease that progressively destroys insulin-producing cells. This means that over time, the pancreas loses its ability to produce insulin entirely. Initially, some people with type 1.5 can manage their blood sugar with lifestyle changes or oral medications, but as their beta cells are gradually destroyed, these treatments become ineffective. Without enough insulin, blood sugar levels rise uncontrollably, leading to serious complications like nerve damage, kidney disease, and cardiovascular issues. Many doctors hesitate to prescribe insulin early for fear of patient resistance, but delaying insulin therapy in type 1.5 can be worse. The longer blood sugar remains uncontrolled, the more damage occurs in the body. Early insulin use can help preserve any remaining pancreatic function, reduce stress on the pancreas, and improve long-term health outcomes. Recognizing that insulin is a necessary treatment, not a failure, can make managing type 1.5 diabetes much easier. The key is early intervention with the right treatment strategy. Is type 1.5 often linked to other autoimmune conditions? Since type 1.5 diabetes is an autoimmune condition, it's not surprising that it often occurs alongside other autoimmune diseases. The immune system mistakenly attacks the body's own cells, increasing the risk of developing multiple conditions simultaneously. One of the most common coexisting conditions is Hashimoto's thyroiditis, an autoimmune thyroid disorder that leads to hypothyroidism. People with type 1.5 are also at higher risk of celiac disease, where the immune system attacks the small intestine in response to gluten. Other autoimmune conditions linked to type 1.5 include rheumatoid arthritis, lupus, and pernicious anemia. The connection between these diseases suggests that individuals with type 1.5 may have a genetic predisposition to autoimmune dysfunction. If you have a personal or family history of autoimmune diseases and have been diagnosed with diabetes, it's crucial to investigate whether it could be type 1.5. Understanding this link is important because managing autoimmune-related inflammation through diet, lifestyle, and targeted medical treatment can improve overall health outcomes. If you have unexplained symptoms beyond blood sugar issues, consider getting tested for other autoimmune conditions. Is type 1.5 diabetes preventable or curable? Unlike type 2 diabetes, which is largely preventable through lifestyle changes, type 1.5 diabetes is an autoimmune condition, meaning it cannot be prevented in the traditional sense. The immune system attacks pancreatic cells, and there's currently no known way to stop this process entirely. However, early detection and proper management can slow the progression and preserve insulin function for as long as possible. While there is no cure, research is ongoing into potential treatments that could halt or delay the autoimmune attack. Some studies suggest that lifestyle factors like low inflammatory diets, stress management, and gut health may influence autoimmune activity. Certain medications, like immunomodulators, are also being explored to slow beta cell destruction. The key to managing type 1.5 is early intervention. The sooner you receive an accurate diagnosis and start the right treatment, whether it's insulin therapy or a personalized approach, the better your long-term health will be. While there is no way to reverse type 1.5 diabetes, understanding its nature and taking proactive steps can help maintain better blood sugar control and reduce complications. Recognizing type 1.5 diabetes is life-changing, and getting the right treatment can mean the difference between struggling and thriving. In conclusion, type 1.5 diabetes, or LADA, is a hidden autoimmune condition that often masquerades as type 2 diabetes, leading to frequent misdiagnosis and improper treatment. Unlike type 2, which is driven by insulin resistance, type 1.5 results from an immune attack on insulin-producing cells, leading to a gradual decline in insulin production. Early symptoms like unexplained weight loss and persistent thirst can be misleading, making proper diagnostic tests crucial. While not preventable or curable, early intervention with the right treatment, often including insulin, can help slow progression and prevent complications, improving long-term health outcomes. Thank you for tuning in to Levitas. Please share today's video with friends and family, comment, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated, it helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.